Hello, I read the Kelly article dealing with elderly people in cognitive decline and kind of how relational learning and cognitive flexibility, those are two interventions they mentioned, could be used to help keep with independence and cognitive ability as they get older. There wasn't a whole lot of research on these topics from what I read in the article. There was one that they mentioned where um, cognitive function was benefited with the use of medication and relational learning. So there's more that can be done to kind of see how this would work. That was done with Alzheimer's patients. So this could be done with people that are just aging generally and aren't really suffering from neurodegenerative diseases like that. Um, One thing that they did talk about was how these two interventions they talked about, relational learning and cognitive flexibility, are built upon the foundations of relational frame theory about how we relate stimuli in ways that are not based on physical properties. So I think that this would benefit me in my future as a BCBA, and that I would be able to maybe apply some of these relational learning principles to clients who may be having trouble keeping knowledge, maintaining knowledge. Maybe it would help with um, preventing that knowledge that they're gaining from disappearing, or helping them gain skills that they may be having difficulty memorizing or keeping in their brain. I figure that if it can work for adults with cognitive decline, it should be sufficient to work with young children or even adolescents who may be kind of having trouble in that realm. And that's all I have. Thank you.